When someone gets a cancer diagnosis, particularly breast cancer, suddenly everything happens very fast. They're supposed to go for surgery as soon as possible. There's chemo involved, there's radiation. They have to decide what type of surgery. Do they want a full mastectomy? Is it just a lumpectomy? Are they going to do both sides? Do they need radiation? What type of radiation? Port or a PICC line? Like all these decisions. And these are huge decisions, and they don't have the leisure time to actually go through everything properly. And none of their options are pleasant ones. It's either deal with cancer or have an aggressive surgery, or aggressive surgery plus aggressive radiation. Not what you would choose to do if you had other options. So by the time they come for physiotherapy or occupational therapy or massage, they've not had a great time of it. And it's your role to help restore their humanity. During the hospital time, a lot of my patients talk about feeling like they're just their diagnosis. They are this person with breast cancer, and it's always how to treat the breast cancer, and nobody really cares about them as a person. Obviously, the oncologists and the surgeons and the radiation technicians, they're all trying to help this person, but they don't have the luxury of time like we do. So it's all about saving the life rather than treating the person as a whole. So loads of gratitude to the oncologists and the surgeons. But once they've finished saving the life, eradicating the cancer, it's over to us to help restore the humanity. So their time with you is special, therapeutic touch. And this is how working on that physical scar is really going to help the person. Just by the very act of making this incision, nerves are going to get cut. And when nerves are cut, sensation is altered. So the best way to help normalize and restore this sensation is lots of touch. So the first thing I tell all my patients is just touch the scar. There was one lady who I saw about 3 months after her mastectomy, and I asked if there was any numbness, and she had no idea. She had not yet touched her scar. So if you have the luxury of seeing someone before surgery, this is the #1 piece of advice that you can give them. Start touching early on. Even while the dressings are on, they don't have to do anything to the scar. They can just rest their hands over it. They can go from resting their hands on the towel over the scar, to on the clothing over the scar, to eventually directly over that tissue. So we all know that our emotions and what goes on physically are very much linked. If you get really angry, your blood pressure goes up. This is obvious, we know this. If you're scared, your heart starts racing. Emotion causing physical response. And it also works the other way around. Deep compression, like a hug, causes your oxytocin levels to rise. It makes you feel happier and calmer. So it shouldn't be that much of a surprise that working on an area of tightness, whether it's muscular tightness or scar tightness, getting that tightness to start relaxing and softening, that there's going to be a release of emotions as well. When I work on emergency C-section scars, very often the moms feel that anxiety and the panic from the time of the C-section. And whatever they were feeling at the time of the mastectomy, that's probably going to come out while you are working on it. So occasionally you'll find someone who was really accepting of the mastectomy. They wanted to survive so that they could raise their kids, and they embraced the fact that they had an early diagnosis. Other times they did not want the mastectomy and they felt totally out of control and afraid. That's going to come out. Maybe not in the first session, but just be prepared for it. So create that space. Don't judge. Don't try and stop somebody from crying. Just let it come out. Make sure you have tissues at hand. Mix it up. You need to get them past whatever their mental block is. Okay, so we've got breathing, we've got trunk mobility, and the scars themselves. As I said, working with the tension. Skin rolling can also work very nicely for a more mature scar. If I can do it one-handed, it's just rolling along the skin. There we go.